So we're more on the preventative side of health and wellness, where hydration and nourishment, everyone is always in some kind of dehydration, malnourishment state.
Receiving an autoimmune disease diagnosis is frightening, overwhelming, and life-changing. LaTanya Bias, PhD, experienced these emotions when she was first diagnosed with lupus over 20 years ago. Although lupus chose her, she has learned to adapt to lupus while living her life to the fullest. Hosted by LaTanya Bias, founder of the Love Life Lupus Foundation, the Lupus It Chose Me podcast offers inspiration, information, motivation, and encouragement for lupus sufferers to take back their life. Mrs. Bias will share lessons she has learned over the many years she has lived with lupus. A variety of professionals will join LaTanya to discuss what the disease is, what causes it, who it affects, the symptoms, life stories, and most importantly, ways for you to love your life with lupus. Join LaTanya as she guides you on your journey through life with autoimmune disease. Hi, everybody. Welcome to today's podcast. Welcome to the Lupus It Chose Me podcast. My name is Gina Hill, of course, and I am excited to be here with our guest today. His name is Todd Wesson from Vitalogy Wellness. So we are going to give him a Lupus It Chose Me welcome. Welcome, Todd.
Thank you, Miss Gina. Thank you.
We are so excited to have you here.
Thank you. It's exciting to be here.
We know that you are a wealth of information. So we are going to jump right in and ask you to tell us a little bit about yourself, a little bit about Vitalogy Wellness.
Absolutely. So
let's go.
Vitalogy Wellness started about 5 years ago here in North Texas. We have 3 locations, Addison and Dallas and Frisco. And I have a nutrition background, but I have a medical director on board for the state of Texas and work with Austin, who happens to be here with me.
Hey, Austin.
My registered nurse that is working with us here at our 3 locations in North Texas. And I'm actually giving Tanya an IV as we speak.
I got to do my Vanna White version.
Yes, she's not just talking the talk, she's walking the walk today by getting a health and wellness IV in studio.
So, Todd, what exactly, Tanya's getting an IV, what exactly is IV therapy or hydration therapy? Hydration therapy. And why has it become so popular?
So most people are used to seeing or hearing about IVs only in a hospital setting on a reactive basis because they had to go to the ER or they're in the hospital for something going on with them. So we're more on the preventative side of health and wellness, where hydration and nourishment, everyone is always in some kind of dehydration, malnourishment state. They're also in, which is a great for our topic today, they're also always in some kind of inflammation state.
Yes.
So whoever they are, no matter what their diagnosis, they are always in some kind of inflammation state. So that's key to remember. That is important to know when intravenously, the bag, for example, that Tanya is getting, which is did it hurt, Tanya?
Not at all. And I am a chicken when I say I'm a chicken.
Yeah, so she's getting a bag that's equal to 2.5 gallons of drinking water. So this is a 1 liter bag. This is a lactated ringer, which starts out as a base of electrolytes, and then we add an electrolytes, right? Kind of like the Gatorade of intravenous, so it's going actually into the vein as opposed to drinking it, of the electrolytes, such as magnesium, sodium, all the base things that people need to rehydrate.
Okay.
On top of that, then we go back and add all the vitamins and minerals A to zinc, A to Z. And then we have at the end of this bag, we have the glutathione right for her today. So she'll be getting here shortly as she comes up to the end of this bag. She'll be getting glutathione, which is the body's master antioxidant.
Outstanding.
What are some of the other IV options that you offer other than this one?
So this one's a good go-to. The other one that I wanted to talk about is definitely the MSM. So that is a natural anti-inflammatory. So that is really good for allergy sufferers, any kind of inflammation going on in the body. MSM is going to help. There are books on MSM. And so that is a key thing that we can add to this particular bag to the point where it's all about absorption. So we can add so much of that to this health and wellness, and it's going to be one more compound within the IV therapy, one more tool in our toolbox, if you will, so we can help a patient's inflammation status.
Which is a big key for us. Having an autoimmune disease, inflammation along with pain is one of our two most vital. So to have this is very important.
Absolutely.
Well, and a lot of people have inflammation, but they don't know that they have inflammation.
That's right.
Exactly.
Or have allergies and things like that are from inflammation, and they don't realize that they have inflammation. So, Todd, that's great that you offer a therapy that addresses that issue. I have a question for you. A lot of people are very skeptical about new wellness treatments, especially when it involves needles, right? So you introduced us to a friend of yours that's sitting next to you, Austin, I believe.
Yes,
so my question is, are the people who administer, like Austin, the therapies certified medical professionals, and is it safe for everyone?
Yeah, so Austin can answer that go ahead.
So everyone that administers the IVs, typically in this nutritional setting for hydration therapy, for any type of IV that you're getting outside of the hospital, has to be administered by a medical professional. So typically, I myself am a registered nurse, with the state of Texas. So, as in regards to your question about it being safe, we follow the same protocol that I would follow in the hospital. So all about, aseptic technique. We clean the site. We make sure everything is clean. We always wear gloves. I'm just on the safer side just because of my background, but I always clean it probably more than I should. But we follow all the protocol that we would, just as if, doctor was watching over my shoulder. So we just ensure everyone's safety, make sure all types of IVs are administered safely. So, and it typically doesn't hurt. Everyone has a different sensation of pain, but I would consider it's just a small little jolt of a poke, and that's it. Super easy. We try to make it quick and easy.
So to give my experience, he made me feel so good. He was encouraging. He made me think of positive things in regards to, to get my mind off just the steps that he needed to take in order to input the IV in. So when I tell you the experience is wonderful, I felt just a slight little prick, and that was it. And when I tell you, I'm like, hey, do you got a baby needle? Because I'm such a big chicken, and I didn't need it, based on whatever size needle that we used. But
it's a standard.
And I feel great. I woke up with a migraine headache today. Of course, I had excruciating pain, but this has taken me to one step level to make me feel a whole lot better. And I think I got that maybe about 10 minutes ago. I started feeling, much, much better. So.
Yeah, she's been dripping for about 40 minutes now.
Yeah,
and so as she's stating, as of 10 minutes ago, those feelings are starting to happen with her, and she's starting to feel better.
Mm-hmm. Yeah. Right. Thank you. All right. Thank you. Todd, that some people are very, I think, Gina, didn't you mention about people being skeptical, right? Skepticism. Okay. Yeah. So what I was going to ask you, I think my question was related to how most people have their vitamins and minerals. We get them, through multivitamins. And I know we need so much of that daily. How important you think it is?
I think it's especially with an inflammation type disorder, such as lupus, being, the inflammation is what keeps the nutrients from being absorbed across the blood-brain barrier wall in the stomach. So you're having an issue when you actually take an oral supplement. If there's, excessive inflammation, it's going to even have that much harder of a time being absorbed. Traditionally, statistically, it's, you're only going to get, 20% absorption at best for anything that you take oral. This bypasses, the IVs bypass the stomach, go directly into the blood system, and thereby having 100% absorption, and it lasts longer.
Okay, that's great.
So the skepticism can be, they've done studies from NIH, Mayo Clinic about how important vitamins and minerals and nutrition are supplement-wise to the body. Whole foods obviously is the best possible way to get a lot of those, but so many people don't have time to eat like that where they would get enough nourishment. So IV therapy would be the next best thing as far as nourishment, but also from a hydration standpoint, because nobody drinks enough water, and we see that every day in our clinics.
Which one of your IV therapies is the most popular one?
I would say the one you're taking now, Tanya, is the Health and Wellness with glutathione. We do the glutathione at the end because it actually it's a bully molecule, so it fights with all the nutrients that are in the bag, so we can't put it in the beginning. So as you saw, Austin kind of snuck in there and administered that specific 400 milligram dose of glutathione, which is a form of 3 different amino acids.
Nice.
The body's master antioxidant. So that's our most popular.
Okay.
All right. So on that note, we're going to take a quick break, Todd.
Okay.
And we will be back in just a few minutes.
Hey guys, what's up? Are you ready to train your body from the inside out through progress, not perfection? Center by JH Method is a full-body progressive workout system created by Jordan Hill that has been uniquely designed to help you with mobility and strength while helping you achieve a toned and lean physique. This progressive workout system was uniquely designed by a professional dancer and model. She has incorporated core stability, lengthening and strengthening sequences, and low to high intensity fat blasting interval training. Whether you're 16 or 60, come discover the magic in your body with how it moves through functional movement through a core-centered tempo-based workout. Follow us on Instagram at CenterByJH. You can stream us online coming soon, and get ready to get centered and join the fam.
Living with lupus doesn't define who I am.
Living with lupus doesn't stop who you can be.
Living with lupus doesn't keep me from following my dreams.
I choose to.
I choose to.
To love life.
Lupus is a systemic autoimmune disease that occurs when your body's immune system attacks your tissues and organs. It is estimated that at least 1.5 million Americans have lupus. Diagnosing lupus can be challenging. And according to blackdoctor.org, lupus is one of the top diseases misdiagnosed in African Americans.
Help us find a cure for this mystical disease.
It doesn't affect just one of us.
It affects us all.
To learn more about this horrible disease, please go to lovelifelupusfoundation.org and help us find a cure by making a donation.
Hello. I hope you guys enjoyed that great commercial that we just saw. Thank you and welcome back. Remember that if in turns you want to continue to watch our shows, to like and share and subscribe. And remember, go back and look at other episodes and watch them all the way through. So welcome back. We have Todd, my beautiful Todd.
Thank you, Tanya.
So I want to follow back up on one of the recommend ingredients for your packages that you offer.
Absolutely.
I know that there's some great nuggets that you were explaining. So can you dive in a little bit more about some of those?
So the IV that you just received is the Health and Wellness with glutathione. And one of the other key IVs that we definitely want to talk about today is the MSM.
Yes.
Dietary sulfur is what it's called. And that is a key component to our IVs, especially for any kind of inflammation state. So natural anti-inflammatory, good for allergies, any type of issue that's going on when it comes to inflammation. MSM is a great go-to. It's one of the few substances that we can actually use in the IV world intravenously as opposed to taking oral that is not done very often in IV clinics. IV clinics don't usually have MSM in their toolbox, to administer as a supplement, and we do.
And how often you think you recommend for treatments?
It's going to depend on how well they're taking care of themselves. So if they're hydrating and drinking a lot of water and eating a lot of fruits and vegetables, depends on where they are in that process. So if they feel like this week I'm just not getting enough water, it's a hotter time of year here in North Texas. They're not eating enough fruits and vegetables and getting that nourishment, then that would be a time to come in for an IV.
Now, mention of the weather. I know, mention of the weather. We're supposed to be getting a cold front here.
I know, Monday.
Yes.
Day after tomorrow.
How would we handle that? Should we do it in advance, or do you think
I think
with
it's
autoimmune
going to
disease?
it's going to be anything that you feel like right now, most people, it's been hot here in North Texas the last, week or so, since the last cool front. And I think now would be a good time.
Yeah, I agree.
So I have a question, Todd. You mentioned, good times to have the therapy, but is there a regimen, or would there be a regimen you would recommend, for instance, in terms of how often to have hydration therapy, like once a month, once every 3 months? I live in Arizona, and I do hydration therapy as well here in Arizona, and I go every 6 months. So what would you recommend?
I think 6 months is too long. I think that I would hope that when I hear someone as saying 6 months, that they are just drinking a lot of water and eating a lot of, fruits and vegetables and taking their supplements for that. But we know that that's hard to do, in a real life environment. So I would say, at least maybe once a month. I think that people are going to feel when it's time. They're just really fatigued, and they're really just, know that they're dehydrated. They can just feel it. Maybe their skin is tight. There's all different ways that people know their own, I just don't drink enough water, right? So I think that those are the times, as we were talking about, that's the most appropriate to get an IV.
Okay.
The 1 liter bag equal to 2.5 gallons of drinking water is a great way to biohack and get something done immediately. It takes about 30 to 40 minutes, and you're in and out. And you don't always have to get, like our IVs and cost. It can be expensive, And Tanya was talking about, hey, it probably starts at about $160. But we have a base bag for just hydration without all of what she received, but it does still have a base vitamins in it for $129.
Okay.
So that's that's a good way to come in, on a regular basis and not be too expensive. But how expensive is good health? What is the cost of not having good health, right? And so when you're dealing with any kind of when the patient is dealing and their doctor has dealt with any kind of disease state, this is a good way for them to personally come in and feel better and have that booster on whatever's going on with them. Maybe they just finished a marathon and they need to be rehydrated, and they know they're not going to drink enough water during that time, that they get back to a baseline of hydration. So there's lots of different ways that they can, and when they start to feel that, they sleep really good that night.
Yes.
That's the great thing. Once you get like tonight, Tanya will sleep like a baby.
Yes.
And she might say, oh, well, I don't have a problem sleeping. But people go into this really deeper sleep because their body goes into homeostasis, which basically means a peace.
Yes.
Their body is renourished, it's rehydrated, Maybe it's been weeks, months. We had a patient come in that was referred by her bariatrics doctor. She had not had any IV bags, any IV hydration intravenously since her surgery. And she finally got a recommendation from a different bariatrics doctor to go in and have an IV therapy to get some hydration. And it was the first time she had actually felt good since her surgery.
Well, you know, one of the things that I know, I'll speak for myself and our community with, people with autoimmune diseases, when we have a flare up and we go to the hospital, the first thing they do is give us an IV with fluids, and then instantly we start, once they find out, my physician, so everything is connected through our network. So they kind of know what to provide me. But in the beginning, before that, it was, okay, so what are your symptoms? And so when I said inflammation, I'm in pain, blah, 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 then they know what to put in to provide for me so that I can feel better. So over the years, I knew that when I'm feeling like I'm having a flare up, I need to go get an IV. I need to go to the doctor and get an IV, and then I'm fine. And then I keep going, And
that's the great thing that you bring up, Tanya, is that cost.
That's what hit me.
What you doing? It's how much money is that going to be? It was
thousands of dollars, and still today, medical bills, because going to the doctor just to get that one thing that you can offer, way less. That was the key for me to keep striving and moving on.
So come in for we're simplifying
less time
here,
too.
And less time. Again, we're going to just take, and maybe that's all you need.
Yes, it
now,
was.
We're not diagnosing or treating, right?
Right, we're not.
But we can come. But you are empowering yourself to save money.
Yes.
And go in
and time,
which is money, and you're going to get that nourishment that a hospital is not going to provide. That's
right.
And again, that's going to be thousands of dollars. Now we know on a national average that it's, I think, then. Going to like an urgent care is like, I think it's $400 and something, and it goes up from there. So it can come into our facility, and if price is an issue, they can get one of our just base bags for just the $129. And at least get that rehydration, and some good nourishment that they haven't had, and then be able to leave and go on their way.
Yes.
So yes, absolutely. So that's a good point that she brings up. Yeah, Gina.
So Todd, how do you know what to give a patient when they come in and they feel bad and they, I'm dehydrated and I have autoimmune disease? And so where's the baseline? How do you start? Where do you start?
So when you have anything going on, a lot of people, it is depending on how they feel, because we're not going to diagnose or treat them. And we need to ask them some questions. Hey, what's going on with you? And they say, well, I'm having a flare up. I have lupus. And when they say that, then we know that that's a little bit more involved with, for example, the IV that Tanya just received about health and wellness and glutathione. We need to get those things on board that are more in depth as far as how much of the nourishment through all of those vitamins we give her. So we'll be giving her extra B complex, extra vitamin C, extra magnesium, and then adding on that glutathione at the end of the IV, the glutathione boost that you referred to it as. Those are important things for what's going on with her, because that's what she asked for, because she knows she needs a little bit more nourishment than the average person.
And now my coworker, when we first visit the facility, my coworker and I came in. So I kind of gave my scenario what I wanted, but my coworker had been drinking the night before. So she was a little tired and fatigued, and because she had, been and definitely dehydrated because of her events she had the night before. So they were able to offer her something different from me, and she was up, perking, ready to work, and and going. And now that's like her go-to regimen.
So it's like, what are you doing with the immune system? The immune system needs what when it's compromised? It needs more vitamins and minerals as a start. So when an immune system is compromised, When you've been drinking, guess what? It's been compromised. Why? Because the alcohol kills vitamins in the bloodstream.
Yes.
So that's her version of a flare-up. Mm-hmm. So it doesn't have to be about me and about, hey, I have lupus. Well, she has the same thing going on in her body.
That's right.
And she didn't have lupus. Mm-hmm. She has a flare-up because her body has been totally deprived of a lot of vitamins and minerals and hydration because she was drinking the night before. Mm-hmm. So,
and I didn't think about it. Tamika woke up with a migraine headache today. This would have been perfect
absolutely.
For her, and getting an IV so that she can get the get that taken care of.
It's a good place to start. Mm-hmm. You don't ever want to diagnose or treat somebody as a migraine because you don't know what kind, what's going on with them. But it's a baseline of what we call biohacking, a baseline of actually helping somebody rehydrate and re-nourish.
Okay.
Again, especially this time of year, could definitely possibly help it.
Oh, yes. I love it. Love it, love it, love it. So tell me a little bit. Oh, go ahead, Gigi. I was going to say about the August 1st launch. I'm so excited.
Oh, yeah.
Oh, that's where I was going to.
Oh, good. Okay. Headed in the right direction, or same direction.
Hear about that. So during the break, you told us a little bit about something that you're doing that I think is going to be a game changer.
Yes.
For a lot of people. So tell us about that.
Yeah, so a love, of course, of being involved in IV therapy for 5 years and seeing people's difference when they come into the clinic and when they leave has always been one of the biggest, heartfelt things that I can see, that you're doing the right thing by humanity, right? But I can only reach so many people, doing that with the 3 clinics here in North Texas. So I, a few years ago, started working on a software that would help people educate them on their blood work. That's called myvitalogy.com.
Nice.
And that's going to be launching August the 1st.
And what was that again?
myvitalogy.com.
Got it. Okay.
And that's going to be launching August the 1st. And we work with labs nationwide. We have about 3,500 that are in our system. And anyone can go starting August the 1st to myvitalogy.com. They can order just a wellness panel.
Okay.
And that might just be pulling simple blood work. They can go in, order that, less expensive than most. So it's a great affordable way to pay for it yourself, especially people have high deductibles insurance and they have to pay for things out of pocket or they don't have insurance. They can go right on to myvitalogy.com, order a lab panel, go right into the lab that same day without an appointment, and then the results come to their phone the next day.
Nice.
That's awesome.
Man, what a difference that would make in our community.
Absolutely.
So, and Todd, I think you mentioned that if you don't have a high deductible, but you have the
HSA card
with the FSA or
HSA card and the FSA card, those are pre-taxed. They're not taxed, so there's a debit card that your employer, for example, will give you that you can use for medical procedures.
Okay.
Nice.
All right. Well, you know what? We could talk to you.
Oh, yes.
Absolutely.
But unfortunately, we have to, our time is limited and we have to go now. So
already
it's
time.
I know. So
promise us that you'll come back.
I will. I can't wait. I'm excited.
And where can our viewers find you?
So the wellness clinics here in North Texas, Addison, Dallas, and Frisco, they can call us 214-444-3109.
And what is that again?
That's 214-444-3109. And an actual live person answers the phone.
Yes, they do.
Isn't that amazing?
Yes,
and it's actually a clinical registered nurse. So
love it.
We have only clinicians that answer our phone lines. They can get you into any one of our 3 locations. We're open 7 days a week. Choice of menu options are at vitalogiiv.com. So I'll spell that out. It's VITALOGYIV as an intravenous.
That's right.
Informationvenus.com.
Thank you, Todd. It was a
Absolutely.
pleasure.
Thank you for having me.
Thank you for coming.
Sure.
You just don't know what you have done to this community. You provided a wealth of information that is needed. And for that, I thank you.
Absolutely.
Thank
My
you
pleasure.
so much.
Glad to be a part.
So nice to meet you, Todd. Thank you.
You as well, Gina.
Again for being here. And when I come to Dallas, I will absolutely come see you.
You better. We're gonna make sure of it.
Therapy with you.
Look forward to it.
Thank you so much, everybody, for joining us today, and we will look forward to seeing you next time.
Bye.
Bye, everybody.
Bye, everybody.
TTYL.
You've been listening to the Lupus, It Chose Me podcast with Latanya Bias. Latanya is a native of Chicago, author, and philanthropist. She has a PhD in business and is the founder and CEO of the Love Life Lupus Foundation. Although she battles lupus every day, Latanya is committed to creating awareness, sharing knowledge, and funding a cure for this disease. Married for more than 20 years, she has 3 children and 3 grandchildren who light up her life. Until next time, Latanya wants you to remember you can learn to love your life with lupus. You can learn more about Latanya and her work by visiting the foundation website at lovelifeLupusFoundation.org. Her book, Lupus, It Chose Me, is available at Amazon.com. Follow us on Instagram and Facebook. Subscribe, share, and listen on Apple Podcasts or wherever you like to stream. Thank you for listening to today's podcast. The opinions of the guests are their own and do not represent the opinions of the Lupus, It Chose Me podcast. The podcast content is informational only and is not intended to treat, diagnose, or cure. You should consult with your doctor or medical professional before you make any decisions that could adversely affect your health.